So if you look at this global strategy on digital health, what the World Health Organization had formed this division of digital health in February 2019. So just about 4 years back, 4.5 years back. And this is the first thing they have done. They have brought out this global strategy on digital health 2020 to 2025. And they're defining digital health as the field of knowledge and practice associated with the development and use of digital technologies to improve health. What is digital technology? Earlier, the commonly used term was ICT, or Information and Communications Technology. So now even that terminology has been shortened to digital technology. So wherever we are using such information and communications technologies and other forms of digital technologies to improve health, that is digital health. So the definition is quite simple. So obviously it covers a very wide. Now, what does it really include? Firstly, there is e-health. What is e-health? E-health is nothing but wherever we are using internet, the World Wide Web, for health, for learning about health and for healthcare delivery. Then m-health, that is mobile health, where the mobile phones and particularly the smartphones are being used for getting information about health education, as well as healthcare delivery. And telehealth. We all know during this COVID-19 pandemic, this telehealth, m-health, all these became very common. And obviously since then, the use has come down, but it's still much higher, at a much higher level than it was before the COVID-19 pandemic. So if you look at all the terms here, whether it's electronic health record, whether it's electronic prescription, telemonitoring, teleconsultation, tele-expertise, teleassistance, all these things together are trying to offer digital health. In telehealth, tele means distance. So we have this RPM, remote patient monitoring. Now, tele-home care is becoming very popular even in countries like India. And whether it's a healthy person or a diseased person, a sick person can be monitored very efficiently at his or her home without having to visit the hospital. And that is already being done in a big way. Now, three more terms which we need to have some idea about. First is the simplest. We have all heard of it, digitization. What is digitization? The process of converting analog to digital. Earlier, we had analog television. Now we have digital television. Analog computers are digital computers. Now, even the analog clocks and watches are being replaced by digital clocks and watches. So that is when you convert anything from analog to digital, paper to electronic, that is digitization. The next step is digitalization. What is digitalization? It involves the organizational and cultural changes to include and maintain technologies in the process of service delivery to meet established public health goals. So here, it's not just digitization, but also it's involving the organizational and cultural changes. In other words, even to bring in digitalization, what you need is a very important thing that is known as change management. And that would be needed even more in a much larger magnitude, very huge scale, to bring in digital transformation. That's the ultimate phase we are aiming at. What is digital transformation? Complex and multifaceted process that is disruptive and fundamentally changes the culture, operational models, and goals of public health services centered on the health needs of the public. So it is person-centered, community-centered, and the whole process, the whole way, the workflows they work is being transformed to make it digitally enabled or technology enabled. So this is one important thing you have to always keep in mind. What's the difference between digitization, digitalization, and digital transformation? Those of you who may be from cardiology background would think of digitalization as something else. When you start, the digital is medication, but that's a different thing. Even if you think of the word digit comes from our fingers, and that's how the numbers came. Digits also means numbers because number counting started with our fingers. So don't be worried by the word digit, how it is presented to us. But remember these terms, these are all standard terms. So digitization, digitalization, and digital transformation, and we have to all work towards digitalization and finally digital transformation. For that, again, a very fundamental requirement is what is known as digital literacy. What is digital literacy? That is the individual's ability to find, evaluate, and compose clear information through writing and other media on various digital platforms. The examples: how to use a web browser, whether you are using Google Chrome or Mozilla Firefox or Microsoft Edge, whichever you use, understanding to use the browser well is not easy. And not everyone makes use of the multiple features that any browser offers. Then the most abused one, search engine, Google. How many of you know how well to use Google? That's a huge challenge. We always think that, oh, asking Google is very simple. It's not so, because the computer is nothing but an idiot box. It does not do what I want it to do. It only does what I tell it to do. So unless your search query is framed intelligently, you won't get the answer you need or the answer you are really looking for. Similarly, for emails, blogs, wikis, everything, you need to know how to use it properly, how to evaluate properly, and what is the trustworthiness of the information. Then the next important thing, that is data literacy. That is the ability to collect, manage, evaluate, and apply data in a critical manner. Here the keyword is critical manner. Another way to define it is the ability to read, work with, analyze, and argue with data. That means don't take any data on its face value. When we are applying it to health or healthcare, that becomes health data literacy. Digital health literacy is the sum total of the digital literacy and health data literacy. And that's now becoming an essential component to utilize the digital healthcare data to transform it into an actionable information so that we can have information-based health policy making. So one thing which is very important is to know about what is an electronic medical record. Electronic medical records are essentially episodic records which are collected mostly during inpatient. When a patient is admitted, the inpatient records that could be in the same hospital or different hospitals, and the multiple times could be in the same hospital. So you may have multiple electronic medical records. One person can have multiple electronic medical records. Similarly, a person can also have a PHR, that's the personal health record. And now with the wearables that we have, the Internet of Medical Things or Internet of Healthcare Things. So whether it's a Fitbit, whether it's an Apple Watch, whatever it is, we can put those data, we can have the cumulative data from multiple electronic medical records and the personal health record and put it into the EHR. But mind you, EHR, electronic health record, is not a medical record, it's a health record. That means it doesn't contain only about the disease, but also about health conditions like immunizations and so on. And it's a longitudinal record from birth to death. So EHR, electronic health record, is a longitudinal record from birth to death and can be formed with data inputs from multiple EMRs and the PHR. So that's a basic concept. When we talk about digital health, anything digital health, these are the things, everything will center around this EMR or EHR or EHR. Now, one of the very important technologies which is being hyped a lot and is of course affecting healthcare in a big way, that is AI or artificial intelligence. So artificial intelligence also, so we are having now regularly people are thinking how best to use it and use it properly with less adverse. So the Indian Council of Medical Research, they have brought out an ethical guideline for application of artificial intelligence in biomedical research and healthcare. After that, we brought out another report from the National Academy of Medical Sciences. I was the co-chair of the task force for artificial intelligence in healthcare in India, and we published this report in April 2023. So I'll just talk briefly, a comparative thing, what's the difference or what's the highlight of the ICMR guidelines and the NAMS guidelines. This was one of our papers. This came out in 2020. Why do we need technology-enabled but safe and ethical workforce for the healthcare delivery? And here what we wanted to say is that ethical and safe approach is adopted to develop and use. It's ethically, the training is important. And of course, we need to enhance the capacity of the human resources for health so that the application of digital health technologies, including AI, is done in an ethical and safe manner. That's very important. So in the ICMR guidelines, if you look at its applications, it had given stress on diagnostics and screening, therapeutics, drug discovery and development, clinical care, epidemiology and prevention of disease, behavioral and mental health care, health management systems using AI. So it could be either for a single doctor clinic management system or for a hospital management system. And what are the guiding principles for the development, for the validation, and for the deployment phases? Ethical issues for reviewing protocols. So all these are important issues which have been detailed in the ICMR guideline. In the NAMS guidelines, what we try to do, we try to divide it into the sections. First is, of course, what is the need and what are the applications. Then, for example, we took digital pathology as an application. What are the challenges? How is AI creating impacts, various use cases, the technology initiatives, policy and regulations around AI, and of course, privacy. Then we did a current situation. We did an observation or a review. What are the implementation status and challenges? Then what are the potentials? Then, of course, we made the recommendations. The recommendations are a way forward. We put in 3 categories: the short term, medium term, and long term. So what are these? So that's how we tried to put into the guidelines. The main challenges that we identified, and this is very important, and that is where each of you can contribute a lot. There's a tremendous lack of data in ready-to-use form. India, we have a huge population, the demographic dividend, but collected data may not be in a usable form. That's very important, and that's where the health data literacy comes in. So we don't know which data to collect for what purpose, and therefore we cannot use it. The next part comes the inadequate infrastructure and connectivity, particularly in rural areas. Of course, now the 5G rollout has already begun, and probably in a few years we'll also have the 6G connectivity around. In fact, India is also going up in a big way in the hardware manufacturing for these connectivity, 5G, 6G technologies. Then the important area is lack of regulation and governance about how these technologies will be used, who will be responsible for deployment, and how data privacy and security will. Of course, this Digital Personal Data Act, the DPDP Act 2021-2023 has come into effect in 11th of August this year, and we'll talk about it in the third lecture. So now we have something to talk about for regulation and governance. Next, again, a very, very, very significant problem is skill shortage. We don't have enough of skilled personnel to build and deploy AI solutions. Again, here what happens, we are not doing a proper requirements management. So someone who has a hammer believes that everything else in the world is a nail. So you can hit the nail with the hammer, but always it won't work. If your problem is a screw, then hammer is not the best solution for it. So that is very important, that we need to be having appropriately skilled personnel who can actually make best uses of the digital health solution. Then adequate and timely funding and investment. This is again an area where a lot is being talked of and done. Then ethical and societal concerns. Whether ChatGPT is good or bad, there's already a lot of discussions and debates over it. But despite all these challenges, there's a growing recognition of the need to overcome these, which requires political will and vision, fully realize the potential of this technology. And that's what we are trying to achieve.